The COVID-19 pandemic continues to wreak havoc on our community. Currently, there are over 6,000 confirmed cases of COVID-19 in South Carolina that have resulted in 244 deaths in our state. Over the next hour, medical experts will update us on the medical and mental health aspects of this pandemic, as well as testing. Here is 5th District United States Congressman Ralph Norman.
Good morning. I want to thank all of our listeners for taking the time to join in. This is the 5th of a series that we are doing. The first 4 had to do with the funding through the CARES Act for this pandemic. This particular program today will deal with the personal mental aspects, and we have got a great group lined up to talk. Our first guest for 20 minutes will be Dr. Connie Guille. She is a psychiatrist, an expert on stress and depression. She is also an associate professor at the Medical University of South Carolina. Our second guest, who will have approximately 20 minutes to speak on the subject, is Michelle Leach. He is the director of the South Carolina Department of Social Services. Michael has extensive experience in child and adolescent needs, child welfare, and crisis response services. And our final panel will include Anita Case and Dr. Craig Charles. Both are from Affinity Health Center here in Rock Hill. Anita is the center's executive director, and Dr. Charles is the medical director for Affinity. I want to thank our broadcast host today, WRHI here in Rock Hill, who produced today's program, WZZQ in Gaffney, WBCU in Union, WDXY in Sumter, and Comporium Cable, which is in York and Lancaster counties. You can follow me on Facebook, Twitter, and Instagram at Rep. Ralph Norman, and visit my website and sign up for the email updates on norman.house.gov. We will have a replay of this entire hour posted later this afternoon on my website at norman.house.gov and my Facebook page, facebook.com/Rep. Ralph Norman. Dr. Gill, welcome.
Oh, thanks so much for having me.
Well, appreciate the time today, and for the next 18 minutes, we want to zip through some questions. We're leading isolated lives now as a result of COVID-19. Can you talk a little about the effects this pandemic has had on our mental health?
Sure. So we know this pandemic has actually had a very significant impact on mental health. Nationally, calls to our federal mental health crisis lines, our hotlines, are up about 900% greater than where we were the same exact time last year. And that's not so surprising, given that we know that stress plays a really important role in mood and anxiety and substance use problems. And in particular, those with pre-existing mental health problems, stressful life events can be very destabilizing. And I'd say to add to this problem, prior to this pandemic, we already had a very high prevalence of mental health problems in this country. About 1 in 5 Americans have a problem, and more than 50% of them don't get treatment. So this pandemic has really added some insult to some pre-existing mental health crises in our country.
You know, you bring up an interesting topic of depression, and, during the everyday course of living, all of us go through periods where we're down and just really don't know which way to turn. How do we know when depression or anxiety reaches the point where we need to get concerned about it?
Yeah, that's a great question. Yeah, because our mood and our anxiety does fluctuate, and it's a very normal and adaptive way to respond to our environment. But we know that there's a problem when those mood states, that anxious state, that depressed state, it persists, and it's there for most of the day, nearly every day, for at least a week or two. And most importantly, that mood state is really maladaptive. It's really impairing our ability to function in important ways, whether it's to take care of our own health, to take care of our relationships, to work, to be able to take care of our children, our families. So it's really looking at kind of the persistence of that and the duration and how it's impacting us. And that's really when we know it's a problem and we should get some help.
And what would you suggest? What are the warning signs that we all need to look for, clues that someone may be having trouble that's out of the normal? Can you talk about that just a minute?
Sure. So, there's a lot of information that we can get just looking at someone is behaving and how they appear. And anytime you're seeing any major changes in how somebody looks, whether they seem more sad or withdrawn or agitated or angry, or they're not attending to their hygiene like they normally do, or they're behaving differently, so they're not getting out of bed, they might be withdrawn or isolated, they might be using more drugs and alcohol to cope. So these are just some of the things that might suggest that someone's struggling, but checking in with them would really help you figure out what's happening.
Yeah, I don't think you can go anywhere during this pandemic and not see the look on people's faces. I was talking to a policeman a couple of days ago, and he was saying the despair that you can just tell that's there. From a mental health standpoint, is there any evidence to suggest that the pandemic may affect men and women differently?
Sure. So there's some really important sex and gender differences in mental health and substance use disorders. So women are twice as likely to experience mood and anxiety disorders compared to men, and men are much more likely to have substance use problems, although women are catching up a bit in that area. Where there's some really important differences is how people seek and receive treatment. So women are likely to reach out for treatment more so than men, and they both have barriers to care, but some of those barriers to care are a little bit more unique for women. Both men and women experience, stigma, difficulties with insurance, time off from work, transportation issues, trying to seek treatment and get services. But some of these, because of some of our gender roles, are a little more heightened for women. So, women are, many are mothers, and there's a lot of stigma with being a mom and having a mental health problem, or because, women typically spend a lot of their time doing uncompensated things such as child care and elder care. They might be less financially independent in comparison to men, and therefore have more problems with health insurance or transportation, or just having means to afford child care so they can attend treatment. So where this becomes really important in the big picture is if we think about women's roles in our culture and our society, is they're often the glue of families. They're the ones that are taking care of people's needs, making sure everyone's doing okay, and when they're not doing well, really families and communities fall apart. And so what we need to do is we need to make treatment more accessible or acceptable, I guess, to men, so that they're getting more treatment, and we need to make it more accessible for women to be able to seek services.
Yeah, and with the mother is most likely with that child day in and day out, and just relieving that mother of a couple hours of watching their children for them, I know can go a long way. The mother has a lot of responsibilities now more than ever. Let me ask you this: if any of our listeners now feel like they need to speak with a professional about a mental health concern, or if one of their family members or coworkers they feel is needing some help, where should they start? What resources are those that would be available that they can call and get help?
Yeah, and so I'd really think about kind of two groups here. So there's the folks that, over the next week or so, it makes sense for them to be talking to someone and getting into some treatment. And there's those that would really benefit for some getting treatment started right then, where they're really in crisis and need some immediate treatment. And for those that are in crisis, we are so fortunate to have in our state, through the South Carolina Department of Mental Health, a community crisis response and intervention team. So this service is for any adult or child in our state that is experiencing a mental health crisis. And they can reach out to them by phone. They're available 24 hours a day, 7 days a week. And what it does is it'll link you by phone to a mental health professional that can do a clinical assessment and then link that person to the appropriate level of care and make sure they're following up with them to make sure they have access to treatment and they're getting treatment started. Other resources such as National Suicide Prevention Lifeline is fantastic, and the National Domestic Violence Hotline. Both of those are available. I would say that in terms of someone needing to be seen in a week or two, wanting to reach out for treatment, if there's one silver lining in this pandemic, it's that we are finally able to deliver mental health treatments to patients' homes via video visits. And that has really been a game changer in making these treatments accessible and available to patients. So I can speak to services at the Medical University of South Carolina, the Institute of Psychiatry. All of our services right now are done via home video visits to patients' homes. So if they could contact our department and get set up for services. If you're wanting something more local, Substance Abuse and Mental Health Treatment Service Locator is a national resource that you can type in your county and look at what's available in your area and calling those places to make sure they're open and that they accept your insurance.
Yeah, and let me tell the listeners, we'll put all of these resources on our website at norman.house.gov with numbers so that you can make it easier to call. Doctor, what about anonymity? A lot of people don't, particularly if they have a loved one or somebody that they wanted to request help that maybe would not call on their own. Expand on that just a little bit.
Yeah, so if you're concerned about somebody and reach out to them directly and assess kind of how they're doing, how you can get them some help. And you can encourage them to call if you're concerned about suicide, encouraging them to call these hotlines. But loved ones can also reach out to crisis response teams to get them to come and assess somebody if they think that is needed. The other thing that they can do is they can just encourage that person to get an appointment with a mental health provider. They could make that appointment for them. They could make it easy and accessible for them to get to that appointment.
And it will remain anonymous who's making the request, right?
Yeah, of course.
Great. Now let's go a little bit deeper. Suicides are at an all-time high now, particularly among our veterans and among those that are distressed about what the business is suffering. What warning signs should we be aware of with those who are suicidal?
Sure. So in terms of warning signs, anybody where you're really seeing a major shift in their behavior, maybe they have a pre-existing mental health condition and maybe you can tell that they are not doing so well. Certainly drugs and alcohol, when that gets put in the mix, those people are at much greater risk for self-harm as well. But also just access to means. So really important that we are making our homes safe and securing any firearms or getting firearms out of the home if you have somebody who you're concerned about harming themselves, making sure you're getting rid of any stockpile of medications or getting rid of some alcohol or other drugs in the home, just making a safe environment for people and staying with that person, monitoring them, make sure that you're with them. And again, reaching out to community crisis response and intervention team if you're really concerned imminently.
Yeah, and a lot of times it starts with asking the simple question, how are you doing? And you can normally tell with people's faces how they respond, what they say. If it's something that is a lot deeper than what's shown, then you can take action. On our mental health providers around the state, how are they taking patients now?
Absolutely, yes. And as I mentioned, a lot of them are able to do that via home video visits. So it just makes these treatments much more accessible.
And what would somebody in a home who would like to have a visual interview, what would they have to make that happen? A computer, a phone? What would they need?
Yeah. So they need to have an internet connection for the video piece of that, and they also need to have an ability to have a camera either on a desktop or a laptop. They could do this on a smartphone. So sometimes when folks don't have that hardware, we borrow it from somebody else. Wi-Fi is pretty easy to hook up to in public places, and obviously trying to keep social distancing. But oftentimes you can at least find somebody who you could actually borrow a device or get an internet connection.
Okay. Touch on diet and exercise and the correlation between our mental health and a good diet and exercise. What do we need to be aware of?
Sure. So exercise is really, really helpful just for reducing stress overall and then therefore decreasing people's risks for mental health problems. But we've also seen exercise being helpful in preventing depression or a recurrence of depression. We've also seen it to be helpful to reduce stress and craving for substances. So I can't say enough about exercise and how helpful that is. And same with diet. So diets that are with the least amount of processed foods, the more whole foods, the more water people can be drinking, the better people's mental health and physical health.
All right, specifically children. A lot of times the child has issues, particularly with something like the pandemic. What can a parent do to protect the children from a mental health issue, or what steps would you suggest that they follow?
Yeah, so the whole balance is thinking about kind of age-appropriate, honest information while allaying children's concerns and worries. I think what I would start with as a parent and an adult is checking in with where you are emotionally with this, because children mirror our emotions. So you really want to make sure that you kind of have your emotions in check when you're talking with them. And just checking in to see what are their thoughts about this, how are they feeling, what are they thinking about, so you can allay any of those anxieties. And then you can also model for them really adaptive coping mechanisms. So, what can you do to feel better right now? And often kids, it's doing something outside or doing an art project or craft, or maybe just sitting and cuddling with their parent for a little while. But really just checking in with yourself, knowing your kids are going to mirror your emotions, model as much as possible adaptive coping, and just keep checking in with them and see where they are.
Well, you touched on this at the top of when you first opened the program about drug and alcohol abuse that's pretty rampant now. I think the data that comes out will show this. There's a jump in the substance abuse. What's some of the effective ways that we can protect ourselves and really those from going down that path of alcohol and drug abuse?
Yeah, so, if that's not something you normally do, don't start now, obviously. And if you've noticed that you are starting to have an uptick in your alcohol use or drug use, there are services available. And in fact, there is a service at MUSC where patients can access their service without any sort of an appointment, Monday through Friday, 9 a.m. to 11:30 a.m. And again, we'll give you those phone numbers and contacts where you can just call and get seeing someone evaluated and get treatment started. So if you're noticing that you're having an uptick in use or that use is starting to impact your functioning or your family, then I would reach out for services.
Well, that's good. And once again, we will post the numbers and all of the data on our website, repralphnorman.com. Dr. Gill, as a wrap-up, and from your past experience, what are 1 to 2 things that our listeners should know that you would want them to be aware of before we end?
Yeah, so I would just be aware of the fact that really nobody is immune to mental health or substance use problems. And in fact, right now, we're all more susceptible to them given the stressors and the trauma that's occurred as a result of this pandemic. And I think we need to appreciate that we already had a mental health and substance use crisis in our country, and that this pandemic has worsened this. And so as we think about this aftermath from this pandemic and as we rebuild our communities, we really need to be working on creating sustainable infrastructure that makes mental health treatment and substance use treatment available and accessible to everyone. And one way to do this, and as we've seen in this pandemic, is using telehealth. And so just a really important takeaway is that we are making sure that insurances continue to support these life-saving services for our patients as we continue to rebuild and heal our communities.
Well, Dr. Gill, I really want to thank you for taking the time to come on the program. What you said is spot on what I think our listeners need to know. So thank you so much. This is Congressman Ralph Norman.